Hey everyone, Dr. Charlie, what's up? I wanted to shoot just a quick introduction to a live video, actually an examination that I did with a patient across seas. He's sort of crooked, has some leg pain. We call this a lateral shift. The most likely cause, almost without a doubt, is a herniated disc and resultant sciatica or leg pain, numbness, and tingling. And I'm helping him work through this process. And look, the video is really raw. The audio is not the best. Yeah, it's super authentic. Okay, it is what it is, but I just wanted to put it out there because, you know, if you can get over that and you can just pick up some of the nuggets, I think there's a lot of value. Specifically, what I want to emphasize is just the process that I help people go through, right? And then that I walked him through to decide, you know, which motions and or which exercise or exercises he should be doing or should not be doing, and kind of how he should be you know, stepping back and looking at this concept of solving his problem. So I walk through what I call a hunting for motions log, where I step him through this idea of testing the body, treating the body, and then retesting, and then following some basic logic. If something makes you feel better, hey, we can do more of it. If something makes you feel the same, we can kind of tweak it or change it up. If something makes you feel worse, well, then we probably don't want to do that. And, you know, he presented something that he thought was going to help him. And he asked, hey, Charlie, can I do this? And I say, hey, let's just answer it. Let's go through the process. Let me teach you my process that you should sort of be having in your brain and walking through to determine and answer those questions on your own. Because again, my specialty is helping people, you know, with back, butt, hip, leg problems, teaching them to move themselves versus a lot of times people go and they go to someone and that person moves them. But the problem is that there's a dependency there, right? Once you leave that person's office, the chiropractor, the PT, the massage therapist, you don't have the tools that you need to solve this problem on your own. So I teach people how to move themselves, and I give them the tools and strategies to do that. And that's what I want to demo to you as I walk Rory through this live examination. So again, he does what he wants to do. I show him, you know, we walk through and see the response of that. We find out that, you know, maybe it's not something he wants to do. And then we compare that to sort of another approach. I expose him to sort of my thought process and we go from there. So check it out. I think you'll see a cool contrast in what he wants to do and the process I walk him through, and then what I want to do and the results of it.
One thing since last week, I did go to like a local GP in Spain here, and he's given me some drugs which I'd rather not take, but I am taking at the moment because so they were for muscle, the usual thing, non-steroidal anti-inflammatories and muscle relaxants. So I have been taking those, and I think things have maybe improved a little bit, but I just want to try and get this fixed, Charlie. You know,
yeah, these aren't, especially if it's shifted and you've got bad leg pain, it's not often a rapid fix. So just know that. I wish I could say it is, but it's usually not. All right, so let's talk about this. So when did this start again, Rory? How long ago, bud?
About almost 7 weeks.
Okay, got
7 weeks ago. Yeah.
7 weeks. And again, what happened? You're not really sure?
I was running, and I just got back from a run, and noticed my back. I was running over some sort of rough ground, you know, and I stopped and I walked back, and I could feel my back a little bit, but the sciatic thing only came on like maybe a week later. You know, the pains in the legs. So initially, it was the back. You know.
Which leg is it again?
It's the left.
Okay, the left only. The right's okay.
The right's fine. Yeah.
Okay, got it. All right, your inability, not that you checked this, but your inability to raise the legs is still present, right? Like straightening the legs.
I can actually straighten my good leg out now, pretty much. Cool. So. Okay. What I've been doing, just I know we're going to go through the routine, but what I've been doing is I've been doing that exercise, you know, that motion exercise. When I do that, I get a sort of a pins and needles tingling in my left leg, in my bad leg, which sort of goes away when I stop. And the only other thing that I didn't mention to you before that I have was I've been sort of a bit constipated, but that's basically everything. Yeah.
Okay. But that's like not a normal thing, correct, for you?
For me, for constipation, no.
Okay.
I mean, I can.
Yeah. Keep an eye on it. You know what I mean? Bladder changes, anything funky there?
No, I've been trying to drink a bit more water, so just urinating a bit more, but not. I don't have any loss of control.
Okay,
Just
cool.
to, yeah.
Yeah, that's fine. Okay, got it. All right, so yeah, let's talk about this. So when are symptoms at their worst?
In the mornings, definitely. When I get
Okay.
up, it takes me sort of maybe half an hour, 40 minutes to actually sort of get going because it's very, very stiff and sort of quite painful on the left hand side. Now, it's not as bad as it was, Charlie, like a week ago, but it's still like super uncomfortable. It's like painful, yeah.
Yep.
And my main sort of this is what I said to this doctor that I had to go to. My main sort of issue is that, well, from my perspective anyway, is that I'm not getting enough sleep.
Mm-hmm.
So I crash and then I wake up like 2 hours later and then I'm up for an hour and then I try and go back and crash again. You know, I need to walk around and loosen things up a bit. And then I crash again and I'm sort of getting 4 or 5 hours a night max, you know.
Mm-hmm.
That's
Yeah,
just
so let's talk about this. So
Mm.
the pain wakes you.
Yeah, I think so. Yeah.
Okay. And then as far as sleeping, right? Have you tested any tweaks as far as sleeping? Able to change what you're doing, positioning, pillows, this anything there you've had luck with or not luck?
I've tried the pillow between the knees. I've tried the folded towel under my side here. There was one night that I actually slept on my back, and it felt much better. It felt better. It felt easier. But most of the time, when I try to like rest on my back, it's like it's uncomfortable. You know, it's so it's difficult for me to get off sleep that
Yep.
way. You know. I haven't tried. I mean, I can lie on my front for a little while, but like after about a minute, I can feel the, you know, even with a couple of pillows underneath. After about, yeah,
Yep.
after minutes, I can feel that going up, creeping up. And
Okay. Yeah, and
so,
on the back with pillow
yeah,
under the knees, all that stuff doesn't really
I've
do it.
tried, I've tried it on the side. I mean, maybe it's just a wake up. I was never like in recent sort of last couple of years. I've never been a great sleeper anyway. So maybe, you know, it's not just the pain. You know, I've woken up, I used to waking up and fall asleep again. But now when I wake up, I'm aware of the pain. Do you know what I mean? So
Yeah.
I couldn't directly say, I couldn't be put my hand into it and say, it's definitely the pain that's waking me up.
I get it.
But what I can say is that when I do waken up, I'm aware of the pain. I feel that I need to get up and loosen things up and walk around and have a cup of tea, and then I try and go back again and get another hour or so, you know.
Got it, man.
Um,
Okay. All right, got it. Yeah. So all right, cool. Okay, so now sitting there right now, what is the leg pain?
it's actually more it's a little more centralized now than it was. So the back pain is not too bad at the moment. I could when we spoke last, yeah, before I became a YouTube sensation.
Oh yeah, yeah, yeah,
I couldn't have sat here for as long as this.
yeah, yeah.
Yeah, without. So I think the pain generally is centralizing. But one question I wanted to ask you, Charlie, is when I'm doing those shifts and I feel the tingling in my legs. So there's still occasional tingling, you know, like funkiness in my leg. Is that kind of normal? Or should when the centralization happens, should that be it? And then that part of it's fixed and you only got to worry about your lower back.
Yeah, it's a good question. So what I'd say is this, right? So there's a few ways. Well, there's more than a few ways. There's many ways, but there's many ways to address a lateral shift. Okay, one way
Okay.
is to try to go at it directly, and what I mean by it is this, Rory. So it's this idea of let's just say you've got this shift, right? Which you do, right? One
Yeah.
way about addressing this would be that you go into yucky. Okay, what do I mean by that? What I mean by that
Okay.
is if pain is here on the left, you know, kind of down here, and you're kind of a little crooked,
Yeah.
right, trying to get away from it, your
Yes.
body wants to go away from it because trying to go into it is often not very comfortable. Okay.
Correct.
And
Exactly.
the
Yes.
shift correction tries to push you into yucky a little bit.
Yeah.
Okay.
Yeah.
And there are various ways you can do it. We could talk about that, but that's only one way that we could use to try to solve it. Okay. So going into
Okay.
yucky would be kind of would be like the traditional shift correction. All right. Now,
like I have absolutely no problem with a bit of pain, you know, we're putting up with a little bit of pain. It's just that I mean, from reading around, it said like, you know, pain is not good, so good with nerve. It's not like a muscle. It's not like you're running or you're lifting some weight.
Yeah,
but I have no problem with that. I was just worried that when I started doing it, I get this sort of pins and needles in the bad leg.
Yeah. Yeah, so I would say this.
Circulation is cut off, you know.
Yeah.
And then it's sort of, you know, where I come back. Yeah. But is that okay, Charlie? Is that's nothing to worry about then,
so,
is it?
I'm going to tell you at this point, based off how acute things still are, right? Let's find a new way to do it.
Okay.
Right? Because the truth is that if it is yucky, right? And look, here's the thing. I can't say this always, but there are two ways to treat things. You can go to kind of huge, broad, like zooming out even more. You can go into yucky or into yummy. Okay?
Right.
Into yucky is shifting, a little bit of symptoms, on, off, on, off, on, off.
Yeah.
In your case, if it's still a little bit like it's reproducing some of the symptoms and it's kind of, you know, it's not clearly, it's not significantly changed after the week or so. Again, it can take some time to solve this problem, but you know, you always want to ask yourself, am what I'm doing right now, or is what I'm doing right now, dropping more kind of, I don't know, money into the yucky bucket or the yummy bucket? It literally can be that easy. So it sounds like what you're telling me is that while the shift correction maybe is somewhat valuable and it's definitely better than it was, it still seems to be a little bit yucky, correct?
That's correct, yeah.
Okay.
But I have no problem putting it through the yucky stage as long as like that's not actually causing any make it worse.
Yeah, no, I get it, man. But for now, right, we've got to consider this, right? We've got to consider that right now, right, we've got this fire that's burning, all right?
Yeah.
And we're trying to put the fire out, all right? So we're trying to pour water on the fire, you know? We're trying to put water on the fire to calm it down, okay? So the water on the fire is, or should be, motion, medication in acute phase, like you're taking, right? And also removing kind of the gasoline from the fire, if you will, right, to calm the fire down even further, would be optimizing the environment such that at any given point you start to, now look, I know you feel the symptoms probably most of the day, but you set a threshold in your brain where you say, okay, so if this is yucky or pain or whatever, and this is time, as soon as, and this is 10, I don't know, 10 out of 10 pain, and this is 0, right? As soon as symptoms get above a 3 or a 4 or whatever, you have got to turn them down so they're not getting out of control.
Okay.
What do I mean by turn them down? Unfortunately, man, you're going to have to be really aware of trying to wiggle or scoot in your chair, or it doesn't even matter what you do. Just, you want to say, if I had to, you know, like absolutely had to, my life depended on it, turn this thing off. You've got the knob because you can position your body any way you want. It might not be convenient, but you can.
Absolutely.
Right?
Yes.
So you need to be asking, oh, it's building. Okay, what can I do? Oh, I could just stand like this. Okay, that's a little better. Okay, cool.
Yeah.
All right, and then maybe you're good for another 10, 15 minutes sitting, and then you start to notice, oh, 30. Oh, do. Okay, oh, I gotta move.
Yeah.
I gotta do something. Okay.
Cool. I'll tell you what I've been doing, Doc, that sort of helped.
Yep.
Because after I sent you that email, which probably sounded a bit panicky yesterday, but I didn't mean it. It was just I started doing some of the compression things, you know, with 2 chairs. Like, you know, use 2 chairs and sort of extend, and that seemed to help.
Yeah.
Is that an okay thing to do?
Yeah. So you were doing traction. You were doing self-traction almost with it.
Yeah. I just got 2 chairs and I was just like doing some dips. You know, well, not exactly. I wasn't doing proper dips because like I hadn't my feet off the ground or anything, but I was just up onto my toes. And when I did that for like about, you know, a few reps and for a few seconds or whatever, that seemed to calm calm things down a bit. Is that an okay thing for me to do, Doc?
Good question. So here's what I'm going to say. Okay. What I want you to do right now, let's do this together. Okay. Here, I'm going to answer your question. We're going to answer it in the long form so you can see it. Okay. And you understand the process. Okay. So what I want you to do is, can we go and can we find like a couple yucky emotions in the body? Now,
Yeah.
not so yucky, just a little yuckies, okay? And then what I want to do is I want you to go do that little dip thing before we talk about other options and other motions. And then I want you to, we'll compare that to a motion I might recommend, okay? And we'll see if yours is better or not.
All right, fair enough. That sounds fair enough.
It might be. It might be.
Yeah.
So
no. I'm sure.
So for example,
yeah.
Let me ask you to do this, okay, Rory? Can you do this, buddy?
Yeah.
Can you go ahead and do these motions?
Right, okay.
Trunk twist to the right. Can you do that like this, buddy? Seated.
While sitting down?
Yep, seated.
While sitting down?
Yep, one rep.
One rep, trunk twist to the right.
Yeah, just seated if you can see me. I'm just kind of twisting to the right as far as I can. You tell me, how yucky is it? 0 is no yucky. It's yummy if it's 0.
Yeah, no, that's good. That's okay.
So I'm going to say it's yummy. Okay. Now,
yeah, that's fine, yeah.
Go ahead and twist to the left. And I want you to tell me, is it yummy or is it yucky?
Well, it's a little bit yucky if I really push it, but it's not too bad.
Okay, now you see this little scoring scale here? If it's yucky, 0 to 100, it's low, it's 10, 20, 30. If it's medium, it's 40, 50, 60. It's high, 70, 80, 90. What number would you give that twist to the left?
I'd give that 30 maybe.
Cool, man, so 30. Okay, bad. Go do your single knee to the chest like this. Pull it all the way up if you can, and then pull it all the way up if you can on the left. So right, tell me yummy, yucky, and then left, yummy, yucky.
Okay, so to the right, that's fine. Here we go. Actually, that's not too bad either.
Not too bad? Is it a low or is it yummy?
It's I would actually say that's yummy.
Okay, cool, yummy.
Yeah.
That's okay. Okay, now do this. Go slow, but do the figure 4, which is like ankle on knee. Okay, so do this motion on the right and then do it on the left.
Okay, that's pretty low chair.
Tell me, yummy or yucky?
It's stiff. On that, this is the good one. And let's try the bad leg. They're just both stiff.
What numbers you want to give them both?
I'm just like really immobile. Do you know what I mean? On both sides, really. But as far as pain is concerned, on the good side, so right over left is I wouldn't say it's yummy. It's just sort of stiff. And bad one, left over. I need to sort of pull my leg up to, to do this. Do you want me to push down at the knee or just?
Not necessarily, just kind of get it up there. So you got to give the right. Is it yummy or yucky? And if it's yucky, give it a number and then the left.
I would say they're both fine. They're both, actually the left one is like low, is like 10, yeah?
Okay. Cool.
But the right one is fine. It's just they're both stiff because I haven't been able to move for them.
Cool. Probably. Now I want you to do this, and I want you to do it very slowly for me, okay? Straighten the right leg out for me, and then the left leg out for me, and stop when you need to, and tell me yummy or yucky, and give it a score.
Okay. Can you, let's see. This is a pretty low chair, so.
Yeah, I can't see you there because your camera's not down. But...
Oh, sorry.
That's okay, man. It's no big deal.
Can you see now?
Yep.
Okay. So this is the good one. This is the bad one. Right, that's about as well.
Yep, got it. Okay, so the right one, is it yummy or yucky?
the right one is, well, just got stiff. It's fine. Yeah, it's much better than it was. When I tried to do this when we talked last, I couldn't have done this.
Yep.
So
the left leg, don't test it. Just give me a number.
to the point where, well, it's fine to the point where you get to here and then it sort of starts shaping. And I would say, I don't know, right there it goes, but I'd say like 40 or 50.
Cool.
Yeah.
Okay. Now, can you do this or no? Are you able to bend forward slightly toward between your legs or no?
To touch the.
Okay, back on up. That's fine.
Okay, yeah, that's a bit yucky.
Okay, how yucky?
Yeah.
Give it a number.
I'd say I don't know, 60.
Okay, pretty yucky. Yep. Okay, and then don't worry about going right or left. Just stand up and go back, straight back for me.
Just the camera.
Sure. Stop if you need to. Try to bend straight back.
Back bend, sit back here. Okay, yeah, that's
give it a number.
I'd say that's, I don't know, again, compared to how bad it was before, that's about 50, I'd say.
Okay, cool. Okay, all right, let it off. Okay, so here's what I want you to do. Okay, so let's just look at the trunk. Let's use something really simple here. Let's look at the trunk. Yeah, let's just look at the trunk. Do you have any other motions? Do you have any shoulder pains or anything like that, Rory?
No.
Okay, cool. So I'm going to take, for example, the trunk twist left, which was kind of yucky at a 30. And then we're going to test something out here. So I'm going to say trunk twist left, seated. I'm going to say that was a 30. Okay, now what I want you to do is go do your dips for me.
Okay. Yeah.
Do a bunch of them. I don't know. Pick 2 sets of, I don't know, 5, 10, 15, whatever you think you can tolerate. Okay. And then let's check back.
Okay. Right. I just have to pop down. Okay.
Yeah, that's fine, man. Come back, but do a set, pick a certain amount of reps that you can tolerate and then break and then do another set and come back.
Okay.
Okay. You did it?
Okay.
Okay, now when you do it, is it yucky? Your dip, is it yucky?
I can feel a bit of pain now after doing those dips.
Okay, Rory dips. How many sets do you? 2 sets?
I did 2 sets of 10.
3 times 10 reps. Okay, cool. Okay, so now go twist to the left for me. And tell me, is it a 30? Is it a 40? Is it a 20? What is it? Same, better, worse?
I'd say it's about the same or a bit less, 20 to 30.
All right, it's the same. And then go ahead 1 time for me, bud, and that's it. Only 1 rep and stop when you need to. Straighten your left leg and tell me, is it same, better, or worse? It was a 50.
It's worse.
Okay, got it. So what is it, a 60?
I would say if I really pushed it, yeah, it would
That's
be.
Fine. No worries. All right, that's it. Let it off. Okay. So this is how you should be thinking about, hey, is this motion okay to do, doc, or is it not? You test the body. In this case, we found a couple things, and actually more than a couple things, but I just picked a couple things that weren't moving so well. For example, you said, oh, my trunk's a little locked up and my leg's a little locked up. Go do, insert whatever Rory wants to do. Okay.
Yeah.
In this case, dips or whatever. All right. And while you did it, you told me something. You said, hey, while I was doing it, it felt a little bit yucky. Right. So you picked a little bit of a yucky.
Time, yeah. It did feel a bit that time. Yeah.
Yeah. So that's okay.
I don't know if it was just my imagination that it seemed to help yesterday, but when I was trying to know it.
Yeah, but, maybe because today, right now, it doesn't seem to help. In fact, it keees things the same or makes something slightly worse. So if you ask me, if we follow some basic logic, look, Rule 1, if something helps, do it again. Rule 2, if something doesn't seem to help, it doesn't seem to really change, it keeps things the same, just try it a little bit differently first, tweak it. If something seems to make something worse, then I would stop it.
Absolutely.
Okay.
Okay.
Now let's do this. Okay. So what I want you to do is I want you to now pick a yummy motion. Let's compare this to a yummy motion. Okay. And what I mean by that is this. So let's go ahead. Okay. And I want you to twist to the right and tell me, is that a good motion still? Is it okay twisting to the right?
Yeah. I mean, I've just got a little bit of residual pain from doing those dips, but yeah, that's fine. Yeah.
Okay, got it. But this motion is pretty good. It doesn't cause you any extra pain, right?
No, that absolutely not. Rotating to the right does not.
Which do you like, standing, sitting, or lying best?
Oh, at the moment, standing.
Okay, let's go stand, and I want you to twist to the right and twist to the left like this, buddy. You're gonna stand and twist to the right and stand and twist to the left, and I want you to tell me what happens with that. Okay, meaning just tell me, is it yummy or is it yucky?
Yeah, so twisting to the right is good. Twisting to the left is not so good.
Okay, cool. So
it's not terrible.
I want you to go to the right, and I want you to give me 2 sets of 20 twists to the right. Look, and you can twist if your legs want to move with you, if you want to, however you want to do it, you're just going to twist as far as you can to the right, just kind of easing into it, go into whatever your body wants to do, and you're going to go to the right for 2 sets of 20.
2 20s, okay.
It can't become yucky at any given point above baseline, okay? It's got to be a yummy motion. Can you handle it?
So I'm getting that tingling in the leg again.
Okay, so it's getting a little worse, correct?
Yeah, yeah.
Okay, that's fine. So let it off, okay? So that's a yucky motion. It became yucky, so you can't keep doing it, okay?
Right.
Take a seat.
It's not really pain, Doc. It's more like just like pins and needles feeling.
Yeah, but I would define it as this. Do you want pins and needles or do you not in your life?
Okay.
So it's still it's still yucky, okay? So go ahead, take a seat, okay? And twist to the right and twist to the left and tell me, start going a bunch of twists to the right and tell me if while you're doing it creates pins and needles, okay?
Okay, well, I'm sat down.
Let's see what happens with this.
Okay, at that time it didn't keep going.
Doesn't cause pins and needles?
Doesn't that cause pins and needles in the seated position, no?
Okay, then keep going. However you want to do it, man. Whatever you want to do, however you want to do it, just keep twisting all the way to the right. Yeah. Give me like 2 sets of 20, a bunch of them.
I mean, I've still got that sort of residual lower back pain, but I mean, that's there.
Yeah, that's kind of your baseline, but I don't want the movement to be increasing it. See what I'm saying? All right, as far as you can twist to the right, as far as comfortable, and keep going. Okay, take a little break.
Okay.
Okay, and go again. Try to go a little further this time. If you need to open your legs a little bit, whatever you need to do, allow yourself to go a little bit further, okay? And if your neck gets sore, you can just keep your head kind of fixed on a spot. You don't have to turn it if you don't want.
All right.
Cool. Break. That's fine, man. Okay. So now what I want you to do, it stays a yummy motion. Okay. What I want you to do now is I want you to test twisting to the left 1 time and tell me what number it is. It was a 30. Is it same, better, or worse? Tell me the number, okay? Any number's okay.
Well, that seems to be better. Yeah, a little better.
What number would you give it? It was a 30.
I'd give it a 20.
Okay, cool. Now, 1 time, go ahead and straighten the left leg. Don't force it through pain. You're just trying to get a sense of, is it same, better, or worse? It was a 60.
Yeah. Okay. I think that's a little better.
Stop.
I think so.
What number is it?
I would say that's 50.
Okay.
It's a little better.
Okay. So 1 second here. Go ahead and do more right twists. 2 more sets of 20, okay? Allow yourself to go as far as you can, as comfortably as you can. That means if you need to slouch a little bit, if you need to, whatever is most comfy, okay?
Okay, that's the 220s.
Cool. Okay, so now, yep, you're going to retest, okay, the left twist 1 time.
Okay.
Go ahead for me. It was a 20. What is it? Any number's okay.
I'd say it's still 20 or a little bit less.
Okay, that's fine. We'll call it the same. It's maybe a little bit less.
Yeah,
We'll call it the same.
Yeah.
Okay, now go do your left leg raise 1 time. It was a 50. What is it?
I'd say it's still sort of roughly the same.
Okay, 50.
Actually, no, it's 40. It's bad. It is a bit better.
Okay, that's fine. So
when I get to a certain point, everything starts to sort of shake.
yeah, you're just trying to ask yourself if the first time you could only go this far, right? Better might still mean that you get the same symptoms, but does your range of motion improve? Does how, you know, that kind of idea. So don't just think of it like, well, yeah, I still get a 70 if I push it all the way as far as I can. But does the
well, definitely the range is a little better. Yeah.
Okay.
The range is a little better. Yeah.
Just so you can see, you did your Rory dips 3 times 10 reps into yucky. Okay. And they resulted in same to worse. Okay. So then I said, well, let's try into yummy. So this was the yummy motion, right? So basically the twist into the good side. All right.
Yeah.
And what do we see? It went down, it went down. So basic logic, if something helps, probably want to try it again, right? So I said, do the same thing. And now you've got kind of, you said maybe this was even a little bit better, and this was better too. But let's just say one stayed the same, one got worse. So we could say, hey, do we want to do it again, or do we want to try to tweak it? So I could say, hey, do more right reps. Or what would a tweak be? Instead of doing reps into the right hold, Rory, instead of doing this, I could say, hey, why don't you slouch or not slouch? Why don't you find comfort and relax using a hold by holding the right twist?
Okay. Yeah.
Why don't you go hold the right twist, and let's test it. Let's just play with it for a minute, okay?
Okay.
I'm going to say the treatment is now right seated twist hold. The holds are a tweak, meaning you're not doing a new motion, you're just changing it slightly, okay? And I'll kind of roughly time you, but 2 30-second holds, you're going to find comfort, try to relax, and breathe there, okay? Break, relax. Cool, and go again. Yep, right trunk twist holds. Remember, trying to rotate the trunk as far as you can to the right, obviously within comfort. Break, and actually I'll have you...
This one's good, Charlie. That one's good.
Yep.
Yeah, I can actually feel my bad side calming down a little bit there.
Yeah, exactly.
Holding as opposed to the twisting one. I think the holding one might be the useful one too.
Yep. So when you find a yummy motion, there's nothing wrong with treating it a yucky, okay? But when you find a yummy motion, you might find that reps work better than holds, okay? So if you find some steps, and I'll show you this, we'll chat about the steps at the end, but I'm walking you through a process is all I'm walking you through, the exact process I use to help treat people, okay? I'm just trying to teach you a little bit of it. Now, go ahead, one more time, hold it to the right. You already have found that I like this motion, Charlie, but I have a couple options. I can do holds or reps, and I think I like the holds better, is what you're telling me.
Yeah. Yes, that's exactly what I'm telling you.
Cool, so keep holding, and yeah, this is why I just follow the process, because sometimes people like reps better and they can't tolerate holds. You know, it all just depends, but.
Yeah. It's a real mystery, this back stuff.
Yeah. Don't worry. It'll keep me busy for my whole life, because nobody will ever figure it out 100%, but it's. Yeah, using motion, man, is really cool. I mean, yeah, it's just fascinating. The body's really fascinating.
Absolutely, and I really do not want to use drugs. It was just my missus, my partner, sort of forced me to go to the doctor there on Monday. So I sort of, I'd really rather not. But anyway,
Well, look, in the acute phase, I mean, meaning in the phase where it's really hot and bothered, I mean, taking meds for a couple of weeks, it's not the end of the world. I mean, as long as you can tolerate it, obviously, but it might actually help calm things down in conjunction with motion. You know what I mean?
Yeah. To be honest, the painkillers didn't do much. I think the muscle relaxants helped a bit, but I don't know.
And break.
That's a good one. Yeah, the holding is definitely.
So now what you're going to do, okay, is you're going to retest the left twist one time and tell me what's the score? Is it a 20? It was a 20. Is it same, better, worse? Give it any number, okay?
Okay. Oh man, yeah. That's like a 10 at most. Yeah, that's good.
10 at most. We'll give 10 at the worst, just to be kind of just to be fair. Now get one time, very gently straighten it, and if you can angle the camera down so I can see.
Oh shit. Sorry.
It's fine, man.
Can you see?
Yep, do the left leg one time, okay, and you're going to tell me what happens with it for same, better, or worse, okay? It was a 40.
That's better. That's more of a range of motion.
Give it a number.
I'll give that, well, that's a 30.
Cool.
That is better, yeah.
Great. Okay, cool. So, and then again, we would follow the logic. Heck, it's not a bad motion. You could do it again if you want, okay? But the point is that I don't need you to do it 1,000 times. I'm just trying to show you the mental process via this kind of the sheet.
Your methodology, yeah.
Yeah, exactly. So what happens is I pick a few yucky motions. I only picked 2 for you because I didn't want to pick things that I thought were too many things that were going to be yucky, because part of the process, unfortunately, Rory, is that you need to retest to see what movement does to those yucky things. And if I have you retesting yuckies 1,000 times, you know, sometimes it can annoy people, right? So point is, you go to the mechanic, you push on the brakes. How do they know, you know, if they fix the brakes? Well, they drive it and they push on the brakes again. And if they don't squeak, then probably it's something that they did right. You know, that kind of idea. So point is I picked a twist, okay? And then I picked a leg raise, right? And then I said, Rory, I'm going to allow you to treat into yucky. Okay, I'm going to allow you to do a yucky motion. By the way, a yucky motion would also be, right, a shift. Or if we think of it like this, is it still here? Yeah, so a yucky motion would be a shift correction also, okay? Although we could have tried it. I could have just said, instead of you doing dips, I could have said, go do your shift correction, 3 sets of 10, come back and retest things to see if they were same, better, or worse, okay?
Yeah.
But I didn't. I just picked one because I wanted to just show you the concept, okay? So another yucky motion. Go ahead.
No, I was going to say it's weird because when I did those, when I was talking to you, you know, for the first time, those shift corrections really took a lot of the pain. You know, when the pain in my leg was really bad, like now it comes and goes. But when it was really bad, doing those corrections, really, although there was pins and needles when I was doing it, it really like centralized the pain. It really got some of the pain out of the leg, you know.
Yep.
So I thought this was some sort of miracle thing after a little video, you know. But now it's kind of different. It's kind of weird.
Yep.
I think.
Yes, and it might change, right? So
yeah.
And keep in mind, there's nothing magical about any motion. Literally, it's this, man. Here, you can move the body forward, north, south, backwards, right, or left. You just chose to move your body right to the, I don't know, we'll just say to the left, sideways. You just chose a sideways motion, but you could have chosen a forward motion, or you could have chosen a backwards motion. So any given motion that you see as an exercise can pretty much fit into forward, backwards, sideways, or some type of rotational component to it, like the twist.
Yeah.
Okay.
Yeah.
And you can do it in various body positions. Standing, we tried twist standing. What did it do? It started to make you tingle more to the right. But when you sit, it feels a little better. We could have
absolutely. There's no tingle at all.
Yeah, exactly. We could have also tried it lying down. We could have tried it kneeling. We could have tried it on all fours. So you can take
Right.
all the things that people call different exercises, and really they're just moving the body this way, this way, this way, this way, or they're twisting it in or out.
Right.
Okay.
Yeah.
So point is that you could go into Yucky to solve this problem. Shift correction, maybe Rory dips, whatever. And even if it worked before, it's not good or bad. There's nothing wrong with going into Yucky per se. But it has to make sense if you follow that methodology. Maybe day one, if we would have gone and we would have said, okay, we're going to put the shift into here. You know, maybe you would have seen that your scores were 90s and it got them down to 50s. And I would have said, cool, that works for the minute. But right now, another motion, you know, or maybe a shift or whatever, it seems to maybe be slightly kind of annoying it a little bit, okay, to me.
Right.
So when you do Yuckies, you get a little bit worse. So I would say, do you want to do more Yucky or do you want to do Yummy? And you'd probably say, well, let's try a Yummy. So I just started with the twist. It helps a lot of people, especially with a shift component. So that would be the other way you could help improve somebody's pain with a shift where they're a little crooked. You could work on the most comfy twist. Find it seated, find it standing, find it lying. Test right, test left, test right, test left, lie down, test right, test left. Which one's yummiest? Go into it. I like standing the best, or I like sitting the best, whatever, and just test it out and find one that's good and plug it into this idea. I'm going to test the body. I've already tested it and scored/rated. I'm going to treat it using this motion, whatever you think you want to do, or you want to try on YouTube, or now I'm helping you, right? Then go retest and follow some basic logic. If it's better, do it again. See what happens, right? If it's the same, which again, you did it, and even though it was maybe a little bit better, but we said, let's try holds because I wanted to expose you to holds. We changed from reps to holds, and what do we find? That works even better.
Yeah, the holds definitely work.
My guess, if you were to keep doing this, right, you might get this to a 0 and you might get this to a 10 or a 20. Okay, cool. So obviously,
Sorry, Doc. How many reps did you say to do? Like do some like every hour, every 2 hours, or?
Yeah. So what I would do, okay, is I would take that kind of winning motion, all right, and I would do, say, 3 30-second holds, 3 times a day, as needed, every few hours. Again, it's a little bit to your tolerance. So it's hard to say, Rory, like, hey, what exactly can Rory tolerate? I'm not in your body. So what I would say is this, though. In the moment, it helps. Does that mean I have a magical ball and I know it's going to help you forever? Not necessarily, but it's better probably than doing your dips, which make things worse in the moment, right?
But they made things better. Well, it seemed to anyway.
Yeah.
Sort of. There's a bit of psychology, there's a bit of psycho stuff in here as well as to, I don't know how much of it is is pain management or the placebo effect or what, but I suppose when I did those and it felt a bit better, maybe it was just, it's kind of hard. It's like kind of nailed down a snake or something.
Now you see what I deal with every day, right? So it is complicated, man, in the sense that there's a lot going on, but this is why I have a framework to try to make it as simple as possible for people, okay?
Absolutely.
There's got to be a system. Otherwise, you'll get lost in all the possibility of, well, I could do this, and I could do this, and I could do this.
50 exercises and 10 of them might work, and 20 of the other ones might not work, and then how do you know which ones have done what? Like,
by having a framework.
One of these things, I mean, walking for me, and then just do this, and then see, and then if it doesn't, try something else.
So what I would say is this, okay? Shifting pain triggers is absolutely something you're going to want to be aware of. Changing the way you're sleeping, changing as soon as you notice, things are starting to go up. You've got to try to move towards comfort throughout your day. Okay. I don't care what that looks like. I don't care how you position yourself. As long as it feels somewhat comfortable, try to let things simmer down. Okay. You're trying to shut the alarm system off. And the more time you spend in relative pain and danger, threat, discomfort, compared to safety and comfort, the more you're going to experience pain. Okay. If you can make more safety, more comfort, it feels pretty good, right? And you can reduce the threat, then you can start to tip the scale towards healing.
So literally,
that's the whole game. Okay. Now, the two parts to healing are, one, healing by subtraction, which is you want to, again, be aware of how you're sitting, how you're sleeping, the habits that you're doing, things that are nicking the scab, keeping it from healing mentally, physically, emotionally. Okay.
Yeah.
And when I say mentally, emotionally, all right, there is at some point a mental component to pain, because they're kind of hardwired together, right, in the system.
Oh yeah.
So, you know, I have some resources for that, by the way, in the treatment portal. You can see a link if you'd like. You don't have to force it. You have, you know, but I think it would be interesting for you to educate yourself a little bit about pain, like kind of just a better understanding, like KNOW, knowing pain a little bit better.
Yeah.
And you can.
I'm well used to pain. I mean, I've spent a lot of my life climbing big mountains, you know, in the Himalayas and the Andes.
Yeah.
And so I'm well used to the mental impact of like, but that was like pure muscular stuff, you know what I mean? And then I've always found like you reach a point when your body wants to shut down, and it's your brain that keeps going. Like under any normal circumstances, you'd never be able to climb that, or you never get up there.
Yeah.
But somehow, if you have to, yeah. You can go beyond, yeah. Yeah, that's nerve pain. It's a pain in the freaking ass.
Nerve pain. You want to push through.
Yeah, I know. Yeah, this is why it's gonna.
Yeah. So what I was saying is there's an app that I as a clinician and as somebody who helps people with these problems, basically I can grant you like 6 weeks free access to it. But it's an educational app that talks about pain. Like these are leading pain researchers basically in the world who help people better understand and kind of reconceptualize pain, things like that. It just might be neat for you to check out. I'm not going to mandate it for you. Some people highly recommend it, but I would still recommend it. But you can check it out if you want. If you need help figuring out where that link is, I can show you it. But it is in the portal. Okay.
Okay. Cool. Yeah. Yeah.
Yeah. The app is called Curable, by the way. Curable. But if you try to get a trial, right, because you're not getting a recommendation from somebody like myself, you won't be able to do it like I can. Okay.
Yeah.
So you could check the link in the portal. But point is you want to subtract pain triggers, or you want to first heal by subtraction, meaning you want to put this guy or girl on a diet, right?
Yeah.
By shutting off the gasoline, cut the gas off to the fire. You know what I mean?
Yeah.
And then the water component of it, right? Healing by addition is add water, pour water on the fire by, in this case, doing your 3 30-second holds, 3, 4, 5 times a day, sure, as much as you can tolerate within reason there. You know what I mean? Yeah. As long as it's yummy. It can't go yucky. And as soon as you notice that something starts to go negative, you stop, you take a little break, we reconvene. Okay.
Reevaluate,
as you can fatten this guy up in the presence of slimming this one down, right? You can imagine that you move closer to healing.
Yeah, sure. Yeah.
Okay.
Absolutely.
So, we talked about going into yucky versus yummy. Okay. That would be the other way. It would be going to yummy. Into yummy. And there's many ways to do that. Twist. You can do it seated, standing, lying, and even other positions, but those are some main positions. Okay. That is another simple way. Sometimes you can do things all fours, etc. So point is that this is what we kind of settled on today as like something that I want you to be playing around with. We do have other options. 3. I'd say there's 4 main ways that we could potentially kind of big picture kind of solve this. And there's even more. But as far as common things, like common patterns of people that help people with these shift type problems. Okay.
Okay. Yeah.
So, but I wouldn't get into those yet. I would just start small, man. I would start testing this one motion along with the idea. You have got to force yourself to get as comfortable as possible. Meaning, if you're telling me, if you were to write me an email in a day and say, Charlie, my pain's at an 80, I'd say, well, Rory, we got you down to, I don't know, a 10, 20. How did it just go to an 80? You're doing something in there that you're not catching it. And you've got to slice it out and figure out a little bit more, because you can't just let this thing, if you let this thing build and it goes above a 30 or 40, then the problem is you're just going to have to lay down and nothing might work at that point. You might say, Charlie, your motions don't work. First of all, it's not my motion. It's just a motion, right? And second of all, it might be too far gone. And at that point, if the fire is raging and you're just trying to like take a pee on it, by doing a couple twists, it's not going to matter.
Yeah.
Right.
Yeah,
so use them whenever you start to notice some soreness, stiffness. You've got to move. You've got to shift you've got to get your environment just right. And then, I'm starting to stiffen up a little bit. How do you know if you're stiffening up a little bit? Maybe once a day or occasionally you say, I'm just going to do a mini left twist. Oh, it's a little tighter than it was when I was with Charlie. I can start doing my right twist holds. Oh, now that's a little better. Cool. Now keep that fluidity going and going and going and going.
Yeah. Yeah.
You've got to stay on. You've got to stay on it. It's not. It's simple. It's not easy.
Yeah. Well, that's yeah. There's no problem staying on it.
Cool.
That'll be. I don't want to put the work in.
Yep. All right. Is that helpful, ma'am?
Absolutely. That's brilliant. Yeah. Listen, thanks a million, Charlie. And I'll do this for sort of over the next week, and I'll sort of ping you, let you know how you get on. I'll let you know how you get on, and so if you need another session, so be it. But hopefully, just carry on with the walking. I love walking, and do these and try and keep it sort of simple, not do too many different sorts of exercises, and just
yeah. So I would lay off of the shift corrections, your dips, all of that stuff. I would only stick with walking. And think about it. Movement is medicine. So if you're waking up in the morning, you're saying, "Ooh, I'm stiff." Maybe you try to twist, drop. What do I mean by that? Lay on your back and drop your legs to the left. How do you feel? Drop your legs to the right. How do you feel? Ooh, this. Okay, let me explain this just so you understand. Okay, if I'm here, remember you can do a twist line, right? It's just the same motion, just a different body position. So if you lay down in the morning, if you drop your legs to the left, it's a right twist. Does that make sense? Because your body is right and your legs are left.
Yes, absolutely, yeah.
If you go this way, it's a left twist. So you might find that this side feels a little bit better, or this side, I don't care. I'm just letting you know. But maybe you find that, I can lay in a twist in the morning, and that really helps me get up and get moving. Or if you notice they're both yucky, get up, sit on the edge of your bed, test. Ooh, okay, cool. Go and do your holds, right?
Yeah, okay.
And then instead of it taking you 45 minutes to get rolling, maybe it takes you 20. It's not going to be perfect right away, but the goal is the trend pushes towards better, and we start moving that way.
All right, cool. I'll absolutely try that in the morning. Absolutely. See if I can get the motor started a bit quicker.
All right, everyone. So that's a wrap for Rory. So hopefully you found that helpful. If you want help like Rory, maybe you're shifted, maybe you have a back problem, a hip problem, a butt problem. This is my specialty. Then go ahead. You can just check the links below. There's www.calldrc.com. That's how Rory reached out to me, how I were able to get in touch and connect to help him solve his problem. So again, this is Dr. Charlie. Thanks everyone for watching. Hopefully this was helpful. Make sure to hit the like button, the subscribe button. And if you have any comments, would love to have you comment below. Thanks. Chat soon.